Seizure is a fairly common incident. A lifetime seizure can be up to 10%. So it is something that everyone should take seriously, very similar to how people have learned to take basic life support, and it can be life-saving for people. If someone's having a seizure, difficult as it is, don't panic. So keeping a level head is the most important thing to do. Keep the patient safe. If they're in an area where they may harm themselves while their movements are occurring, you should try to move them away from the place of harm. Take a look at the person's neck. If they have a scarf that's too tight or a tie, that should be loosened so they can breathe a little bit more freely. The other thing is to make sure, if you can, to turn the person on the side. So if they're unable to control their saliva or their spit because they're not awake and alert, it should at least come out the side of their mouth. Do not stick your hand or any object in the patient's mouth. A person can't bite their tongue off. That's a very common misconception. Someone should be with the patient at all times until the emergency medical service is there, in case the patient is frightened afterwards, confused, or injured. There's no harm in calling the emergency medical service. Try to time the duration of the seizure and try to keep some of the characteristics in mind. Those are the most important things that you can do, and then afterwards the EMS will take over.